Welcome back. A week from Election Day, and the coronavirus pandemic is the worst it's been in this country in terms of corona cases, period. And the numbers are grim. We are now averaging more than 70,000 new coronavirus cases a day. Averaging. At least 44 states are seeing increasing cases. Remember, we only have 50 of them. And there's more than 40,000 Americans currently hospitalized from the virus. President Trump is campaigning today in Midwestern battleground states, which is the hardest hit region in the country right now. Vice President Pence is also on the trail today and not in quarantine, despite at least 5 of his associates, including his chief of staff, testing positive for the coronavirus. Millions of Americans are still out of work, and the Senate has adjourned until after the election, leaving any chance of any coronavirus relief before Election Day pretty much gone. Joining me now is Dr. William Schaffner. He's an infectious disease specialist at Vanderbilt University. So, Dr. Schaffner, where are we in this virus right now? And are we looking at Halloween, done, Thanksgiving, stay at home, holidays, stay at home? I mean, is this what we're staring at for the next 2.5 months?
Chuck, we're in a bit of trouble with this coronavirus. It's increasing over most of the states, as you just have said, the vast majority of them. Hospitalization have increased, and it's a lagging indicator, but down the road there will be an increase in deaths once again. And the weather's turning cooler, which means that influenza's on the way to double our trouble. So it's going to be a rather grim kind of winter, we're afraid. I think that the holidays, Halloween, Thanksgiving, and all the holidays toward the end of the year will conspire to be accelerator events unless families do this very, very thoughtfully, very carefully. Our family's not having Thanksgiving dinner together. We all are getting together for about an hour and a half. We'll wear our masks, social distancing. It'll be a hug-free and a kiss-free zone, but we'll see each other. But we have someone who has an underlying condition, and some of us have gray hair, so we're all being respectful of each other. We need to take care.
I've seen that you've had Dr. Fauci express, and I think Dr. Gottlieb, who, of course, was part of the FDA for a bit under President Trump, both of them have expressed support for a national mask mandate at this point. Obviously, that'd be something that has to be implemented state by state. But is that basically our only tool left before the vaccine at this point, given that we're not going to invest in testing and contact tracing the way that many people like yourself hoped we would?
Well, masks are absolutely fundamental. But of course, it's a layered approach. Masks, social distancing, good hand hygiene, avoiding large group activities. All of those things are very, very important. None of them is perfect, but if we put a series of them together, we can really, we've shown it, we can flatten this curve. And then we're waiting for a vaccine. We have our fingers crossed that we will have an effective and safe vaccine. It also will not be perfect, even after we vaccinate people, because it's going to be a partially effective vaccine. That's what we anticipate. We'll still have to be wearing the masks. That information has not gotten out there yet. But if we put all these things together over a sustained period of time, yes, this year is going to be dominated by COVID. So will the beginning of next year. But toward the middle of the year, if we did those things together, we could go back to a semblance of normal.
So is the president's chief of staff, Mark Meadows, just wrong by saying we can't control this pandemic?
I think he is wrong, yes. Not only have we shown in an intermittent fashion, and the people in Europe have shown, well, there are other countries that have done even better. New Zealand, Australia. The Chinese have done much better, but they have all done this together in a very sustained fashion. Surely we can do that. And then if we add the vaccine to that, we'll do even better. But there's no magic wand here. And this is a marathon, not a sprint, as we say. So we'll have to keep doing this in a sustained way.
On the vaccine front, it does feel you see these stories about halted trials. We have the Eli Lilly news is the most recent. Would you describe the vaccine news as 2 steps forward, 1 step back, or 1 step forward, 2 steps back?
Oh, it's stepping forward step by step. This means that the system is working. We all know that it's not a straight line to developing a vaccine. These are tricky biological products, so we have to do it carefully, and that shows how carefully we are doing it. And then when it's finally released, and we know it's been very well vetted by the External Advisory Committee to the Food and Drug Administration, if only the politicians would stand back and let the scientists and the public health people make the announcement, then we could start building up the trust. Trust is central to the acceptance of this vaccine by the public.
When you've seen the various disruptions and what you've studied from these vaccines, is it more and more likely we are looking at a vaccine that will be in that 50 to 70% protective area, which then translates to you're wearing a mask all the time, even if you get vaccinated?
That's absolutely correct. I'm so glad you've said that. Let's just say, for the purposes of discussion, that we have a 70% effective vaccine. We would all be thrilled in public health. But that does mean for every 10 people vaccinated, 3 people are unlikely to be completely protected, and we won't know who they are. So they, all the vaccinated people and everyone else, will have to keep wearing a mask. It's another thing we can do, but it's not a magic wand, Chuck.
All we need is clear guidance on a national level, and I think a lot of people will do the right thing. But we know what the missing piece has been for about 8 months. Anyway, Dr. William Schaffner from Vanderbilt, it's always good to get your expertise on. Thank you, sir.
Thank you.
We are waiting on Joe Biden.